Okay, welcome everyone. We are so happy you will be able to join for today's webinar on small business funding for technology to improve maternal health. Just so everybody knows, we are recording this meeting. My name is Alana Goldberg, and I'm a program director at NIBIB, and we have a lot of interest in this topic. As you can see, we have 9 partner ICs on this notice, as well as one office, the Office of Research on Women's Health. This notice is being led by NIBIB, and we are specifically targeting the small business community. For this NOSI, we have also partnered with NIH's Maternal Mortality Task Force and the Pregnancy Outcomes Vision for Everyone Improve initiative. I just have a few administrative notes before I introduce our guest speakers. Please feel free to type questions into the chat box at any time during the webinar. We hope to be able to answer all of your questions live in the Q&A. The brief agenda for this webinar: after our introductory speakers talk, we'll have a quick overview of research interests from each of our partner ICs and offices, followed by the live Q&A session. And with that, I am honored to introduce both Dr. Clayton and Dr. Tromberg. Dr. Clayton is the Associate Director for Research on Women's Health and Director of the Office of Research on Women's Health, and has served in this capacity since 2012. She has strength and support for research on diseases, disorders, and conditions that affect women. She's the architect of the NIH policy requiring scientists to consider sex as a biological variable. She is also co-chair of the NIH Working Group on Women in Biomedical Careers with NIH Director Dr. Collins. She will give us a brief introduction to the Improve initiative. Her comments will be followed by Dr. Tromberg, who is the director of NIBIB, where he oversees a portfolio of research programs focused on developing, translating, and commercializing engineering, physical science, and computational technologies in biology and medicine. In addition, he leads NIBIB's 500 million Rapid Acceleration of Diagnostics RADx Tech Innovation Initiative to increase SARS-CoV-2 testing capacity and performance. Prior to joining NIH in January 2019, he was a professor of biomedical engineering and surgery at the University of California, Irvine. He will introduce this initiative for innovative diagnostic technology for maternal health. Thank you very much, Dr. Clayton. You're up.
Thank you, Dr. Goldberg. Can you go to the next slide, please? So the reason why we're here is the fact that the United States is the most dangerous place in the developed world to deliver a baby. And I always have to pause after I say that because I really want that to sink in. Next slide, please. And in fact, the rates of maternal mortality in the United States are going up at the same time as they are going down in every other high-income country. That's why NIH created the NIH Maternal Mortality Task Force that I'm privileged to co-chair with Dr. Diana Bianchi, the director of the Eunice Kennedy Shriver National Institute of Child Health and Human Development, and Dr. Tara Schwetz, the NIH Associate Deputy Director. One of the efforts of the Maternal Mortality Task Force is Improve. Improve stands for Implementing a Maternal Health and Pregnancies Outcome Vision for Everyone. It's an NIH-wide program, and we are prioritizing interdisciplinary research that addresses foundational biology, behavioral, and sociocultural science. We want to gain evidence on the causes of maternal mortality and morbidity, and especially those preventable causes, which represent over 60% of maternal mortalities. We want to improve the health of women before, during, and after delivery up to 1 year postpartum, and promote health equity in the United States as well, evaluating structural and healthcare system issues in populations with the highest rates of maternal deaths and complications. To do that, we want to make sure that we develop community partnerships to assess vulnerabilities and implement interventions to improve outcomes in every setting. So last year in FY20, we funded 36 projects to the tune of $7.5 million, with 17 institute centers and offices participating. I'm excited to share with you that just last week, we issued our FY21 NOC, administrative supplements, and urgent competitive revisions for NIH grants to add or expand research focused on maternal health, structural racism and discrimination, and COVID-19. I'm excited to be here and excited for ORWH to be participating in this SBI or NOC, and I will pass it back to you, my colleague, Dr. Bruce Tromberg.
Okay, thank you. Thank you very much, Janine. It's incredible. We're very, very excited to be able to work together with you and have a long history of working together with ORWH. Your leadership, along with Dr. Bianchi's leadership in the task force, has really inspired us to think about what more of what we can do with enabling technologies that are being developed at NIBIB. And Ilana, thank you so much for your leadership in advancing this NOCI and working together with our colleagues all across NIH, multiple institutes and centers, to really bring this to reality. Let me just tell you a little bit, maybe we'll go to the next slide as I talk a little bit about the context of the NIBIB. Our vision really is bringing engineering technologies to engineer the future of health. At the core of what we do is supporting technology development, ranging in a variety of areas. Much of what we're involved in right at the center are modeling, computation, and machine intelligence approaches, but we support engineered biology, sensors and point of care technologies, imaging and therapeutic devices. Our goal here is to really understand, prevent, and detect disease, personalized diagnosis and treatment, extend health span, reduce costs and barriers to access to technologies, and help drive innovation. So if we go to the next slide, this NOCI really emphasizes this axis of sensors and point of care technologies where there's enormous innovation going on in photonic, acoustic, mechanical sensors, bioelectric sensing, wearable devices, implantable devices, and in vitro diagnostics, combined with what's going on in modeling, computation, machine intelligence, to take large data sets, enhance information content from those, and to connect to digital health platforms to provide more actionable information that's feedback for both individuals as well as healthcare providers. So next slide. So this NOCI really capitalizes and intends to accelerate the commercialization of many of those capabilities that have been worked on and developed in our community for so many years, many of them being now widely available commercial devices, but we're excited to be able to repurpose them for maternal morbidity and mortality. We're looking for things that are measurements that are potentially giving us new insight into factors associated with increased risk. These can range from blood pressure measurements, continuous types of measurements, to measurements of large-scale physiology, pupil dilation, facial expression, biometrics that may give us insight into the onset and exacerbation of various diseases and maternal morbidity and mortality, how to predict risk from a variety of data sources. For example, there is untapped potential in looking at medical charts and electronic health records. We would like to capture this information and alert patients, individuals, as well as clinicians, both to risk factors to prevent a catastrophic event and to manage the outcome in a positive way for that individual, and to provide direct insight into immediately actionable prevention and treatment approaches. We're very interested in a variety of different technologies. The creativity and ingenuity of our community is what we're hoping to capitalize on. And I couldn't be more pleased. In many ways, this provides us with unique and very impactful approaches, avenues for our technologies to be able to be brought into society. We're especially interested in technologies that can be deployed in low resource settings and would have an impact on individuals who might not otherwise be able to have access to advanced technologies. We believe that many of these technology developments are great equalizers and potentially great equalizers so that everyone can benefit from their advances. So with that, I will turn it back to you, Alana.
Thanks so much. Now we'll have the ICs each give their introduction. So NHGRI.
Hi, thank you, Alana. My name is Jyoti Dayal. I'm a program director at the National Human Genome Research Institute. NHGRI is very excited to participate in this effort. So just at a high level, NHGRI supports the development of resources, approaches, and technologies for studies that are focused on many aspects of the genome, which is in that top paragraph. Examples of some of the relevant research include systems for clinical decision support that integrate genetic testing in clinical care to prevent the onset of maternal mortality and morbidity, the integration of diverse data types, for example, family history, other omics data, environmental data, or standard protocols like the Phoenix Toolkit to help improve the utility of genomic information. And then mining data from electronic health records. This will help flag patients who might be at risk of developing maternal mortality and morbidity, and then lowering barriers to access for genetic testing for underrepresented population, and then advancing genomic technologies that have a broad applicability to collect maternal fetal biomaterial mixtures. And what I can do in the chat is put a link for this nosy. Thank you.
Hi, I'm going to just give a brief overview on NIBIB's mission space to reiterate what Dr. Tromberg already said. But really at NIBIB, we are looking for the engineering and design of technologies, advanced algorithms, modeling, point of care technologies for clinical or hospital settings, clinical decision support technologies, and also wearable type technologies that provide continuous monitoring. We are able to fund technology for any disease or symptom target as long as it involves the engineering and design of technology or the re-engineering and design of technology to make it portable, wearable, or change the signal of detection. NICHD.
Wonderful, thanks, Alana. I just want to thank everyone that's on the webinar. This is an extraordinary group and an extraordinary effort. I had the privilege of representing NICHD, and much of our mission in this space is really focused on detecting and predicting and monitoring conditions and disorders during pregnancy and the postpartum period, that fourth trimester, that really contribute to maternal morbidity and mortality. And I've listed here four kind of conditions of relevant research, but I don't want that to be, that's not exhaustive or prescriptive. But hypertensive disorders during pregnancy, gestational diabetes, obstetric hemorrhage, and peripartum infection are four of the main buckets that we often see interest in this space of maternal morbidity and mortality. And given the current climate, another area that we're very interested in are projects that really enhance monitoring and management of women who enter pregnancy with existing medical conditions, particularly as that becomes more and more prevalent. And then also consistent with our mission at the Institute is a focus on certain populations, and that, both underrepresented ethnic populations, but also those that have intellectual, developmental, and physical disabilities. And so it's a broad range. We're very delighted to be a part of this effort, and look forward to communicating with you, the extramural community.
So good afternoon, everyone. My name is Jasmina Varagic. I'm the program officer in the vascular biology and hypertension branch at the NHLBI. And we also have from the NHLBI, we have Dr. Mike Peck, who is scientific program director of the NHLBI Catalyze program. So we are here today to underline the NHLBI commitment to improvement of women's health and particularly maternal health by reducing maternal mortality and morbidity. In the United States, heart, lung, blood, and sleep disorders are the leading causes of pregnancy-related maternal mortality and morbidity. And for this particular NOCI, NHLBI is interested in the projects that may focus on detecting, predicting, monitoring heart, lung, blood, and sleep-related disorders during pregnancy and the postpartum period. And some of these disorders and conditions include hypertensive disorders of pregnancy, including chronic hypertension, gestational hypertension, preeclampsia, eclampsia, peripartum cardiomyopathy, venous thromboembolism, postpartum hemorrhage, sleep disorders, breathing in pregnancy. And in addition to these disorders and conditions, NHLBI is also interested in projects that enhance the monitoring and management of women with existing heart, lung, blood, and sleep-specific disorders and risk factors who enter pregnancy or are considering becoming pregnant. NHLBI welcomes studies testing culturally and socially responsive technologies to maximize their adoption in real-world setting. And we also welcome dissemination and implementation projects that address barriers to uptake of evidence-based practices for heart, lung, blood, and sleep conditions and disorders. And these are only the examples of the NHLBI area of interest, and complete list of scientific focus areas in the NHLBI can be found at the link provided at the bottom of this page. So this is from the NHLBI. Thanks for your attention.
Good morning and good afternoon, everybody. I'm Lauren Hill from the National Institute of Mental Health, and I direct the Office for Disparities Research and Workforce Diversity at NIMH. I'm presenting today NIMH's interest in this really important topic with this very exciting notice. So the mission of NIMH is to transform the understanding and treatment of mental illnesses through basic and clinical research, paving the way for prevention, recovery, and cure. I want to emphasize mental illnesses, and that pertains to mood disorders, psychotic disorders, etc., anxiety disorders, anything that one would see with respect to mental illness, and that would pertain to this, be relevant to this particular NOCI. We are specifically interested in this instance in technologies that predict, detect, monitor, prevent, and or treat perinatal depression and associated psychiatric morbidities, including those that might unfortunately lead to death by suicide. And we are interested in technologies that can alert patients and their providers in real time that morbidity is morbidity is imminent or risk is increasing, etc. Examples of research interests that we're interested in are not limited to the following. We're interested in the development of algorithms that leverage passive data available through medical records or wearable devices. We're interested in testing wearable technologies to accurately monitor symptoms, development and testing of real-time remote clinical decision support technology for providers and or patients, and development of technology that incorporates established prevention and treatment approaches into just-in-time interventions. So interventions where there's already an evidence base, where the technology or the technological advances can help us to optimize or tailor those interventions to improve outcomes. Importantly, I encourage each and every person who's interested in potentially applying to NIMH to please reach out to our program officer. His name was on the slide. It is not here anymore, but it is in the notice, and that is Dr. Adam Haim, and he is responsible for our SBIR, STTR programs. in the Division of Services and Intervention Research. If he's not the appropriate SBIR contact, he will help you to find that person. I encourage that contact to ensure that what you're proposing does in fact fit within the mission of the NIMH, and also to ensure that you understand fully what we expect at our clinical trials. So all of our clinical trials, be they intervention trials, services trials, implementation trials, need to comport with the experimental therapeutics paradigm. And we have plenty of information about that on our website, but I can't encourage you enough to reach out directly to Dr. Haim. Thank you.
Hi, everyone. My name is Myra Alvarez. I'm with the National Center for Advancing Translational Sciences. I am a program analyst in the office. NCATS is also very excited to participate in this effort. NCATS' mission is to advance the science of translation, which is a process of turning observations into interventions to improve health. So NCATS is part of, we participate in the omnibus solicitations for these SBIR STTR, and we are here to transform the translational science process so that new preventions, detections, and treatment technologies can be delivered to patients faster. The center supports the development of clinical technology, instruments, devices, and related methodologies that may have broad applications to research and improve patient care. I've included the deadlines in this slide so you know when our next applications are due, April 5th and then September 6th. Our topics of interest, as mentioned, are preclinical drug discovery and development, biomedical, clinical, and health research informatics, as well as clinical dissemination and implementation research. As you've heard, if you're interested in applying to our program, we encourage all applicants to email us at ncats-sbir-sttr@mail.nih.gov. We request that you provide us with a one-page executive non-confidential summary and any specific aims you'd like to include. We'd like to review your abstract to determine whether your technology is a fit for our program and our topics of interest. And from then on, we can discuss whether your technology fits NCATS, or we can refer you to another IC that might fit your interest better. We'd also can discuss budget limits, as well as any other questions you might have, as well as other NCATS programs that can be made available to you if needed. Thank you.
Hello, I'm Sarah Robinson Schwartz, representing the National Institute of Neurological Disorders and Stroke. Our mission is to reduce the burden of neurological disease, and to this end, we support research on the healthy and diseased brain, spinal cord, and peripheral nerves. Specifically for this NOCI, we're interested in the development of technologies that address maternal morbidity and mortality within the scope of our mission space. Potential areas of interest are include, but by no means limited to, stroke, CVT, migraine, peripheral neuropathies, chorea, posterior reversible encephalopathy syndrome. I would like to specifically note that we do not support clinical trials in our omnibus. So any small businesses proposing clinical trials should consider directly applying to our NINDS exploratory clinical trials for small businesses, either the SBIR or STTR mechanisms, or also consider our small business U44 cooperative agreements. More details on and links to these can be found directly in the NOCI language. Thank you.
Hi, I'm Debbie Linares, program official from the National Institute on Minority Health and Health Disparities, or NIMHD, and the scientific contact for this NOCI. NIMHD is very excited to participate in this NOCI. And just a little bit about NIMHD, our mission is to improve minority health and reduce health disparities in terms of across the U.S. For this NOCI in particular, we are interested in projects that focus on technological innovations to improve health and reduce or eliminate and prevent disparities experienced by racial and ethnic minority women compared to white women. And we in particular are interested in commercially available, affordable, accessible, and culturally acceptable technologies that will disrupt or prevent interactions and processes that create, promote, or sustain disparities. We encourage you to examine social determinants of health and also to inform your work with the NIMHD research framework, which there's a hyperlink on this slide, and consider multiple levels and domains of influence. Additionally, we are encouraging applicants to leverage the capabilities of design or human-centered design thinking to meet the needs of racial and ethnic minority women, to employ multidisciplinary teams with complementary expertise. I encourage you to look at the NOCI for potential NIMHD topic areas, and also look at our website to see a little bit more about our funding interests and priorities. And of course, please reach out if you have any questions or are considering applying to NIMHD. Thank you.
Hi, I'm Mercy Prabhudas and from NIAID, and we're happy to be participating in this NOSI. And the focus of some of our research has been in the basic and translational area to better understand, diagnose, prevent, and treat infectious and immune-mediated diseases that impact pregnancy outcomes. So the main areas of interest, they're not limited to these, but the main areas are: number one is in the area of technologies, to develop technologies to detect and monitor immune dynamics, both normal and dysfunctional, for the prediction of pregnancy complications, such as infections, preeclampsia, sepsis, and the like that lead to maternal mortality and morbidity. And another area is in the area of diagnostics, such as parasitic diseases and gestational Lyme disease. And we'll also like to have some rapid detection modes that can be developed to detect Treponema pallidum from clinical specimens. So if you have any questions, I'll be happy to answer any questions, and feel free to reach out and send me an email to answer any questions. Appreciate it. Thank you.
Good afternoon, everyone. I'm with the Office of Research on Women's Health. My name is Jamie White. I'm the Health Science Strategy and Relations Lead in the office, and our mission at ORWH is to enhance and expand women's health research to also include women and minority groups in clinical trials and clinical research. In addition to that, promote career advancement for women in biomedical careers. So if you have any interest in the work that we're doing in the office, I would suggest that you look at our strategic plan. Specifically, our strategic plan is for the ORWH, but it's also for all of our institutes and centers throughout NIH. So this is the plan for women's health research, and that of hopefully setting the vision for that of NIH. Again, in that we've specifically for this particular NOCI, areas of interest, but are not limited to, are understanding the underrepresented population, so understudied, underrepresented, and underreported women, such as racial and ethnic minority groups of women, also those who reside in rural and underserved areas. In addition to that, we're hopefully looking at maternal health in the context of complex health needs, such as co-occurring conditions of comorbidities, maternal health in women experiencing homelessness or living in overcrowded housing, and or that of women incarcerated and under community supervision. Also, risk factors related to social determinants of maternal health. And then lastly, risk factors related to intersectional dimensions of pregnancy in pregnant women, as such as race, age, and geolocation. If you guys have any questions, please feel free to reach out to me. I'm more than willing to help. And in addition to that, the person is going to be moderating the session. Dave Thomas can also be of service and of help to you guys as well.
So now a few words on our application assistance program. Mike, are you here to discuss that?
Alana, I can jump in. Hi, I'm Sarah Robinson Schwartz again. I head up the applicant assistant program for NINDS. This is a program for grant phase 1 SBIR and STTR applicants who've never received funding from the NIH before. It's a pretty intensive program that prepares you for the for these phase 1 SBIR and STTR applications. To be clear, it does not provide a grant writer or research plan development, but it works with you to develop your specific aim page and review and really understand the ins and outs of applying to the NIH. So it's a great resource for applicants who have limited experience with applying for the SBIR and STTR programs at the NIH. To be clear, not every IC participates in this program, so I do not remember the list of all 8 ICs which do, but please check out the webpage. There's both this Eva Garland link at the bottom, and actually the National Cancer Institute has great resources on their website as well, which apply to any IC participating in the applicant assistant program.
Thank you, Sarah, for jumping in there. It seems Mike had trouble getting off mute, but he is on. So if there are any questions on that, we can take it in our Q&A program. That will be coming up in a few minutes. Just a few quick words on how to apply for this initiative. To apply, we are using our normal omnibus SBIR mechanisms. So that's PA 2265 for R41 and R42, no clinical trial allowed. PA 2261 for the R41, R42 clinical trial required. PA 2260 for our R43, R44, no clinical trial allowed, and PA 2262 for our R43, R44 clinical trial required mechanisms. You would apply normally under this omnibus, but in your application on box 4B, it asks if you are applying under a NOSI. Please put this NOSI number down in the box. That's note EB21-001. Then we will track it in our internal system, and that we will know that your application is in response to this NOSI. In addition, we are also accepting supplements in response to this NOSI. So if you are currently funded by NIH, the institutes that are part of PA 2272 will entertain applications for supplements to current grants. Once again, please make sure that you include the NOSI number in your supplement application so that we know internally that you are responding to this NOSI. And with that, we will start our live Q&A session. Dave, you have the floor.
Thanks, Alana. Hi, everyone. I'm Dave Thomas. I'm with the Office of Research on Women's Health. I'm going to run the questions and answers section. We've got a real lot of questions coming in, and I'm just trying to pull them together as we speak, but I'm really glad of the interest. And let me just say, if we answer your question today, that's great. If we don't answer your questions, I want you to follow what Lauren had mentioned, and standard advice for grant getting is just call your program people. All these people on this screen here, we exist beyond this meeting, and we help. Our job is to help you folks. So just look at the NOSI, find the people, and we'll help you out way beyond the extent of this meeting. So for the first question, I think we got a bunch to get to, but we had a question about patient engagement, and Debbie, you answered it to some degree, but I think this is something we might want to explore a little further in terms of patient engagement and representation as being a factor with these applications. So Debbie?
Sure. And, speaking from NIMHC's perspective, I encourage you to look at the section that we have in the NOSI. We're really interested in human-centered design and, the population that these apps or technology would be used on, in terms of their involvement in the actual development of the product, and their voice, their, concerns and interests being represented throughout the process. So for NIMHD, that's, a major component of what we're looking for. And if you have further questions, you can feel free to reach out to me, and we can discuss this further.
Anybody else want to chime in on that? Okay. Another one just popped in, and I think I want to get to it so I don't forget. But Debbie, you responded to this in the chat box, but the question was, will ORWH be funding applications or grants? And we don't fund grants, but we co-fund them. But we are hoping that's a benefit to this program that might be able to fund more, because we will make it easier for all the ICs you see here, all the institutes you see here, to fund it. So we hope to support this program, but not directly. And Jamie, did you want to add anything to that, or did I cover it?
I think you covered it. Thanks, Dave.
Okay. And then another question, it's like a two-parter that came in, but I think a lot of people have questions and concerns about this, is the type of research that we'll fund. Will it, one person asked about a method to stop contractions, another person asked about oxytocin, and I think we probably should address the question of how much of this approach that we're funding is directed toward this mother's health, the baby or fetus health, or the combination. So I don't know who to refer that question to, but if the panel could jump in.
I will start, and then of course the panel can back me up. But really the focus of this is on maternal health. So maternal mortality and morbidity mechanisms. So while we will look at applications for other types of pregnancy related diseases or instances that could be looked at, they might fall more under our omnibus solicitation as opposed to this NOSI. What I encourage you to do is to write an NIH specific aims page and then get in touch with one of us, or just send it to the email on the screen, and we will look into it and we will get back to you and help you to understand whether it fits into this NOSI or whether there's another mechanism that it's more appropriate for. Anybody else want to chime in there?
Sure, and this is Drew from NICHG, and I want to echo Alana's. I couldn't agree more, and I think we're all we want to encourage you all not to necessarily conform your science to a NOSI, but put forward your best science. And so the emphasis here is on maternal morbidity and mortality, but there's no shortage of extraordinary ideas, and if it doesn't happen to be a perfect fit for this NOSI, by all means, you're absolutely eligible to submit your applications through the parent omnibus solicitations. So to Alana's point, having that, and Dave's point, having the contact with the program officer can help direct, but we certainly don't want to necessarily have anyone feel that if their science isn't in the wheelhouse of this NOSI, that it's not any less important.
Okay. Anyone else? Okay, we have a lot of good questions to get to. So another series of questions I think relates to level of funding by IC, and are some institutes funding more than less? And I answered that in the chat box to some degree, but I'd like the panelists to maybe jump in on that too.
I can start. NCATS is part of the waiver program. So if your technology fits one of our waivers, then you are entitled to receive more than the regular awarded sum. I think the limit right now is $325.
Right. And part of what I'm sorry. Go ahead.
No, but please feel to reach out to our center at NCATS-SBIR-STTR, and we can answer any questions you might have.
Right. And just as a general principle, I mean, people worked at different institutes and now at the Office of Research on Women's Health, but people are often trying to figure out, you got to figure out whether a given institute is a good home for it, that they'll support it if you come in, and that they'll fund it. So just call your program people, see how interested they are in it. And just in general, the SBIR program, STTR, has pretty good funding. So I would just go to the place that best fits your science.
I was going to second that, Dave. Because I also saw other questions, this is Lauren from Mental Health, about what happens if your project is a good fit for more than one institute or center. So along the same lines of it's really important to align your science, your idea with the mission of the particular institute and center, and trying to kind of fit between ICs can sometimes not only short shrift your science, but also kind of miss the mark with the mission of the two that might fit. So as has already been said a few times, please do reach out to the program officer at more than one IC and to judge which one would be the best fit for what you're proposing.
Any other comments from the panel?
If you don't know where to reach out, I would recommend just reaching out to whoever you think would fit the best, and hopefully that program officer or can direct you to the best institute that might fit your technology.
Right. And along those lines, I mean, we communicate and there is overlap between IC's programs, institute's programs, but it's good to talk to multiple program people. And if you could get dual assignment, that would be good, because that lets multiple institutes consider funding your application. So if one institute can't and another one could, then they might pick it up if the primary can't do it. So it doesn't increase your odds that much, but it does kind of help. And these do get passed around from institute to institute sometime to fund the best science. Okay, and then another question I'm reading, it's kind of a theme. I'm seeing a few of these, and this did come up before, but it has to do, somebody asked about whether software would qualify as medical device and things like that. And it brings up the larger question of, when you're in doubt, what you should do. Should you apply for this? If you're borderline, you're not sure if it fits this NOC, where does a person get that information? What's in it, about what's in and out? Any panelists want to take that on?
Right. So what we encourage everyone to do is to write up an NIH specific aims page. Feel free to send them to the institute that you think is most relevant. If you're not sure, you can send them to me at NIBIB. So that's the email up on the screen, nibib-sbir@mail.nih.gov. We will review all of them, and we will help them to make sure that they get to the most appropriate PO and institutes. So please, any ideas you have, write them up. We will review them all and help to get you to the correct spot.
All right. Any more comments on that? Okay, a couple just came in. I think they're kind of related. Drew, somebody wants your contact information. So if you want to put that in the chat, just do that, or Google them.
Yeah.
And and then
right now.
And then they're asking for information of on NHGRI. Yeah, NHGRI. So you can give them that information, or just look at the NOC, because that has every person is signed on, has their information there. So, and then going back, there was a question about how much data one needs, how risky of a program we're willing to take on, how the level of development that one would have to take it to this next step. So.
Right, so that speaks to the SBIR mechanisms that we offer at NIH. So at NIH, our phase 1 grants, they're really proof of concept. It's, can you convince peer review that your idea has a good chance of working? And by the end of your phase 1, can you prove that your idea has a high probability of working? Phase 1 grants are generally for 6 months to a year. So your proposal is to show that with the funding and with that timeline, you can show a proof of concept that your idea is going to work. Our phase 2 grants are for generally for 2 years. And really they are to develop your proof of concept idea. If you already have data to show proof of concept, you can apply directly to a phase 2 for our SBIR grants. And there's no specific criteria for what defines proof of concept. It's what you have that you can show to peer review. If you're not sure whether you fit into a phase 1 or a phase 2, you can always get in touch with your program officer and we can help talk you through it and see where you fit best. I don't know if anybody else has anything to add.
I wanted to add one thing. I just wanted to let everyone know that that the institutes are not the ones that do review the applications. The Center for Scientific Review does, and the institutes have no say how the application is reviewed.
That's correct.
Okay. And anybody else? Okay. And Alana, I was kind of multitasking. One question did come in about fast tracks, phase 1 to 2 together. Is that permissible under this?
Yes. Fast track applications are permissible under this. It means that you are submitting your phase 1 and your phase 2 application at the same time. Just so everybody understands, phase 2 applications, so fast track applications, do require a full commercialization plan for your application. And those commercialization plans are looked at very heavily in the peer review done by CSR. So please make sure if you're submitting a phase 2 or a fast track that in addition to having a strong research strategy, you also have a strong commercialization plan for your application.
Okay. Thank you. And then a question did come in. I answered it to some degree, but maybe somebody can give more details about asking about whether this presentation will be made public, and it will be. It's as a matter of fairness. But do we have the site or information on that?
We are recording this presentation. Then we have to make it 508 compliant, and then it will be posted. I will get it posted on the NIBIB small business webpage and wherever else we can have it posted. Feel free in a month or so to reach out to the email on the screen and ask me where it's posted if you can't find it.
Thanks. And then Cynthia came in with a question about if you have a technology that's developed for a different topic, not on women's health, not on safety during pregnancy or postpartum period, but you have no specific data on women's health, would that make sense to pivot that technology for this purpose?
Absolutely. I think there is a variety of technologies that can be pivoted, re-engineered, redesigned for this women's health initiative. I know I sound like a broken record, but really writing a specific aims page and sending it to the PO, sending it directly to me, that's your best chance of communicating, best way to communicate with NIH and best way to get personalized feedback so that we can help you figure out the best place for your technology and your idea and the best mechanism to use to get funding.
Yeah, and if I could, I'd like to just echo Alana's point. I think this is an opportunity to consider pivoting. Again, not forcing, but if there's opportunity to pivot into this particular space, I think that's one of our goals is to kind of maybe think outside the traditional box about what technologies and applications could be utilized in this setting.
Yeah, and let me just reinforce that, because part of the purpose of this is, you know, we looked over the tools that are out there, and we didn't see that much in terms of our due diligence and scan of the market. So we figured that doing this sort of initiative will help people pivot. That's part of the process, is to get people to apply their technologies to where it's needed. So not only is it you don't have to pivot, you could already be in the field, but we certainly want to. That is part of the concept here. And then I did have one question, which should be pretty easy, but it was asked about whether program projects would be accepted, and I don't think they apply to the SBIR program, but does anybody have any comments on that?
So for this, we are using exclusively the SBIR mechanism. So our 41s, 42s, 43s, 44s, and supplements. for this particular NOSI.
And note that the SBIR, this is not an RFA where we set aside money for this per se, although we might get some extra money for this program. But the SBIR, STTR program is a set aside money. It's a certain percentage of a budget that has to go to this. So we're just, in a sense, it has some commonality with an RFA, like set aside sort of mechanism. And then, let me see. I guess I'd like to just open up to the panel and just, I think we've covered most of the questions. If we haven't, please just call the people. We'll talk to you a long period of time and answer your questions. So that's just a great, if you remember one thing, do that. But I'd like to ask the panel just in general, any tips or suggestions or anything you'd like to share with the audience.
I would say that once you've spoken to your program officer and you've determined that your technology is a fit for the Institute, I think NIAID has some sample applications on their website that are of good use. So you can slightly mirror your application to one that's been through the grant process and has received funding.
To echo that, NIH also has some websites and tutorials on how to write an NIH grant application, and those are very helpful, specifically if you've never written an NIH grant application before. They're free resources for you on the internet that you should check out.
And that does address the last question that I have on this list that just came in is, will sample resources be provided? And a lot of the various ICs will give you, nothing confidential, but they'll give you samples and stuff of how to apply in this program.
Right.
And you can always, yeah, go on.
Yeah, NIAID has sample resources on their website. NIA, I believe, has a specific one just for SBIRs on their website, on their SBIR website.
Right. And if you want to see what's funded, you can go to the reporter site on the NIH and you can get an idea of at least what their abstracts and what sort of things have been funded. Sorry, go ahead. I interrupted someone. Mike?
I was just going to say that the NHLBI also has a YouTube channel called NHLBI Small Biz Hangouts, and there's over 30 full-length webinars on the different aspects of either peer review, the review process, but then also the small business SBIR STTR application itself.
Right.
And I would post. I just posted a link in the chat to the NINDS Entrepreneurial Resources page, which has lots of information.
Right. There are so many helpful people in the SBIR program. It's amazing what they can do for you in terms of this program. And I would also suggest, this is just general grants, but the SBIR is a little different from a regular grant at the NIH, where the regular grant is just about the science and the design and things like this. This has to do with commercialization and the science together. So I would suggest, if you know anybody that's ever applied for these or gotten these sort of applications and you're not that familiar with these, just get advice from people in the business too. We'll give you advice from program, but just people in the field will let you know the ins and outs of this sort of thing.
And just to echo that, the NIH Seed Office, sbir.nih.gov, has a whole website with resources, once again, dedicated just to our SBIR applicants and the SBIR opportunities that are out there.
Oh, here's a good closer question. Let's just wrap it up with this one. But what are the common mistakes you see applicants make?
Not talking to the program officer before they apply, and therefore not having the correct mission fit. I can't tell you how much of an advantage you are at by reaching out to us and talking to us before you submit your application.
And if I could, Dave, and I certainly don't want the last word, but to echo Alana's point, that's not just to communicate about this particular notice, but also to, I think, a a corollary to that mistake is trying to force something into a box where it's not best fit. And again, this presentation is not inclusive of all the great science that's out there. So it's a part of our job is to help navigate the best home for your science, and that's, again, whether it be this or a different mechanism, that's perfectly fine. We just when you try to force science into a notice of funding opportunity, that's when sometimes it comes across as being disjointed.
Right. And I would always advise people that don't apply for what you want to do, because if you get the grant, you're going to have to do it. So do your passion. People tend to do better when they're passionate about what they're doing.
I wanted to add in there that if you don't get reviewed or you don't get funded, that you don't give up. You just continue to apply. You will get comments from the CSR, the Center for Scientific Review, as to why your application was either turned around or not moved for funding. So just talk to your PO about that, and you can always make a better, a stronger application, but you can have better luck next time.
That's right. And so to close it up, we are using the Omnibus SBIR. Our next receipt date is April 5th, and then the receipt date after that is September 6th. There are 3 receipt dates a year. And this NOSI will be open for 2 years, so there's plenty of time to start applying for it. I want to thank you all for coming today. We are always happy to answer additional questions. If something comes up later, send us your AIMS pages. You can send it to the email on your screen, nibib-sbir@mail.nih.gov, or reach out to the program officer or SBIR office at the institute that you think is most applicable for your application. Thank you once again. We are so glad you could come.
Thank you.